This is Jordan Spiegel, nurse practitioner and orthopedic program manager at St. John's Health Center. This video will go over same-day surgery for total and partial knee patients. Same-day surgery is essentially outpatient surgery. Patients come in on the morning of the surgery and then are discharged later that day. The average length of stay in the post-anesthesia care unit, or PACU, for these patients is approximately 5 hours after surgery. In the recovery room, you'll be seen by physical therapy once anesthesia has worn off enough, and a medical doctor or hospitalist will discharge you once medically stable. Not everyone is appropriate for same-day surgery. Patients undergoing partial or total knee replacements and on occasion total hip replacements may be eligible for same-day surgery if certain pieces of criteria are met. First and foremost, patients that would like to undergo same-day surgery should be relatively healthy and have no major comorbid medical issues. It's important also for patients going home same day to live within a reasonable distance from the hospital, which is approximately 30 miles or so. This is important because if you experience any complications or issues following discharge, we would like you to come back to St. John's for treatment. It is also important to ensure you have help at home, or at least for the first 48 hours at home, you'll have somebody there to help you out. Again, this is for patient safety, so if any issues arise, a caregiver will be able to assist you. There is a minimal level of preparation needed from the patient prior to having same-day surgery. This is the decision that should be made well in advance with Dr. Yun's office. So if you're interested in having same-day surgery, please call the office to discuss this. This isn't something that should be set up the morning of your surgery. We need to know in advance. So we also ask that you have a ride to and from the hospital set up and confirmed, as well as the help at home for the first 48 hours organized and ready to go. When you speak to Dr. Yun's office to set up same-day discharge, you'll be asked if you would like home health services to be arranged. This isn't something that's necessary for every patient, but it's essential to have this set up in advance if you choose to have it. It's also a good idea to assess your equipment needs ahead of time, because we will send you home with a walker and or a cane if that's needed from the hospital, but we want you to make sure that you have some form of icing, whether it's gel packs, an ice machine, or ice packs, and think about your other setups like your bathroom. Do you need a commode? That sort of equipment, because you might want to order that ahead of time so you have it ready to go. When you've been cleared medically and functionally, you will be ready for discharge from the PACU. Prescriptions for home will be filled at a pharmacy nearby and delivered to the bedside for your convenience, so you go home with the pills in your hand. Whatever ambulatory assistive device is recommended by physical therapy will be delivered by our equipment manager to the bedside, so you have it before you go home. The nurse in the recovery room will then go over your discharge instructions with you, and if you have any questions or concerns, they can address those at that time. If you have any questions prior to surgery regarding same-day discharge, please give Dr. Yun's office a call at 310-582-7474. Thank you for watching.